This is our 4th of July edition. Good morning, Dr. Bradley Meyer.
Good morning, Dave. Good morning, all out there. Happy 4th of July, 250th anniversary of this great country.
Yes, indeed. And a happy birthday to one of your staff members at Okoboji Wellness Clinic today.
Yes, Paisley Doon. Happy birthday, Paisley. One of our valued team that has been with us for, I think at least 3 years now. She's a pinch hitter. You'll see her in the lab room. You'll see her in the IV room. You'll see her room and guests with me or in the hyperbaric chambers. She is phenomenal, and we're grateful that she is with us, and happy birthday.
Yeah. Well, I actually brought this up on the air yesterday with Lori, and I want to talk with you a little bit about it today. You were front and center on gut health. You were talking about gut health and mitochondria and all of that before a lot of people. And boy, now it's really becoming mainstream. You got Robert Kennedy Jr. out there talking about mitochondria. Ran across this yesterday and I thought of you. This is crazy. They did this study, a single dose of newly discovered frog gut bacterium eliminates 100% of cancerous tumors within just days in mice. A new landmark study found the natural bacterium, now you're going to have to help me out on this, EWINGELLA. Something like that.
Just go with it.
Okay. Yeah, Americana selectively targets, colonizes, and terminates tumors with no detectable toxicity. They reintroduced cancer into the cured animals, and the tumors could not grow. That's the type of experimenting they're doing with gut health. This is amazing. Now, I'm not saying this is going to come to fruition in humans, but the fact that they're doing this type of experimentation with gut health tells us a lot.
Sure does. There's a, pardon the pun, a big appetite for it right now, Dave. And it's, like we said, it's an avalanche, just so much new information coming out every day. Just amplifying, and the gut health, as we've touched on quite a bit over the last few years, is a very critical piece. We talk, this time of year, many of us have gardens planted, and it's important to have a good balance in that garden. You want some fertilizer, you want good soil, you want that balance. You don't want too many weeds in there, and so that's kind of like your gut. And so that's what we want, and what we find is a lot of the different things that are in that, the gastrointestinal tract is what we call it, from our mouth to the exit. It's an important avenue, and not only for food absorption, but what is in there or what is not in there can impact health in so many ways. So they found that different types of bacteria might correlate to wellness and health in certain organ systems. So you have little ones in there, little commensal bacteria in the digestive tract that, when they're there, may be beneficial for a healthy oral microbiome, or it may be helpful for a healthy heart environment or lung environment. So again, you find that kind of this correlation between some of these different supportive bacteria, mycobacteria in there, that correlate with the health and all these disorders. So another one would be the immune system. So when you talk about this case study, and there's specifically, that could be impacting, I'm postulating and theorizing here, but could be impacting somebody's immune health. And so when you go down this path, there's a lot of different ways now when we do that here at the Wellness Clinic, is identifying what's actually happening down in that digestive tract. What does the balance look like? Then there are different ways to go and work on rebalancing that gastrointestinal tract. And things that people have become a little more aware of, like parasites, for instance, it's not commonly treated in the mainstream. I never used to treat it on a really regular basis, but I think there became an awareness over the last 5 years because of the medication ivermectin. And so more and more folks are like, wow, if animals, for instance, so this is not a big shock to farmers that are out there, that because they're commonly running to Baumgars and getting their dewormer for their animals. So the whole point being is, it would kind of make sense that parasites could be an issue for some folks as well, including humans. Mm-hmm. But that, for whatever reason, hasn't gotten as much attention as it has more recently. But so you look at the balance of a healthy gut, are there parasites in there? Do you have an overgrowth of candida? A lot of times I'll look at folks' toenails, and if they're yellow or thickening, you start to think of fungus. That's on the outside. And so then you start to say, well, if that's on the outside, what's happening on the internal environment? And a lot of times that we go back to the gut. A lot of times what we see on the skin, rashes, eczematous rashes, things like that are popping up, those could also be related to that gut environment. Of course, we always talk about food allergies, environmental allergies, but many times the health and balance of that gut can impact the skin as well. But as we've touched on in the past, when we're looking for how much of the gut is a culprit for folks, kind of the obvious thing is bloating, changes in bowel habits, but, maybe some abdominal discomfort. But some of the less common things that we think of that could be related to imbalance of bowel is mood, because that's where a great majority of our neurotransmitters are created. Also, we think about brain fog, lack of energy, the inflammation, pain. All these things can also be contributed from the health and balance of that digestive tract. So I think as we hone into the future here, and that's happening in a big way, is just this huge, it's like the evolution of flight. You find an area, and there's an infinite possibility just in one certain area that can affect change throughout the entire body. So that's why I always tell folks when they're coming to the clinic, and maybe they're, they've reached a point where they're frustrated with how they're feeling. They've tried as many things as they can think of to rectify their health and feeling better. There's always avenues of hope. There's always rocks to look under and discover. And as we call them here at the Okoboji Wellness Tools in the Toolkit, we keep adding more and more of these tools to the toolkit beyond the typical stuff that you may think of in traditional medicine. Of course, we're an integrated medical clinic where we use a combination of tools from more of that holistic approach, vitamin supplements, hyperbaric therapy, ozone therapy, platelet therapy, to, occasionally where we are going to use an antibiotic. For instance, let's say somebody has an H. pylori infection, which when I think of somebody that's got heartburn, and they've probably got low stomach acid, they probably got imbalance in the gut, and they have bloating, abdominal discomfort, I'm thinking maybe they have some H. pylori. So some testing can be done for that. While there's different approaches you can take from an herbal, more natural approach to that. Some folks prefer that because, as we know, the more that we use, the antibiotics tend to be stronger. So they're going to wipe out some more of the good guys in the digestive tract versus maybe more of an herbal approach. They're not going to wipe out the good guys. Are going to kind of go after the ones that don't need to be there. So that in the case of H. pylori, what we want to do is we want that gone, but I'll give folks the option. I said, do you want to kind of go the route of, sometimes we'll use an amoxicillin, for example, and sometimes we'll use what's called triple therapy, which is more of a traditional approach to go after that. But you can do things in combination where we maybe do a little herbal approach alongside some of the traditional. It's really up to the individual, but we just want folks to know that there are ways. There's ways forward. One other example and this is on the same topic, but we're moving out of the gut and the microbiome, is ozone therapy. And a lot of times I wonder, I think about all the folks, the ozone therapy, which is, it's 3 oxygen molecules, and it's like supercharged oxygen. Phenomenal approach to help the body get on that path of regeneration and stimulating mitochondrial activation and so many other really good things. They're out there, they'll be like, well, I've got some back pain and I've got some knee pain, but is that going to be the right choice for me? Is that going to be the rock I need to look under that's going to work the best for me? And there are certain situations. I had one gentleman that came in the last month, and he's been dealing with a knee pain for a year, and I think it's been maybe just over a year. And he does a lot of heavy lifting with his job, and he has been to his doctor, and he's gotten imaging. He's had MRI, and he has had some physical therapy. And I believe he did have a cortisone injection, which didn't do the trick for him. And so he's left with, the surgeon didn't think his case was surgical, okay? So meaning didn't think there was a benefit to go under anesthesia, go into the knee and work in that environment to help fix the pain that this gentleman had. And so he came in, he's like, well, it's not surgical, my surgeon says. I've tried physical therapy. I've tried a steroid shot, and that didn't really work, and I really don't want to do a lot of these steroid shots because I know that they can, over time, we can only do so many per year. They can worsen bone mineral density, and they can affect the strength of the tendons, kind of weaken those over time, so we can only do those so often. Would the prolozone or ozone be an option for me? And it's been a fantastic journey with him. We're five treatments in right now, and it's literally 5 minutes in the clinic for the actual procedure, less than that. And for a guy that was limping heavily and could barely get through his day through the job, he's already at 65% improvement. So he's telling me that this is the best that he's felt in a year. He's got a lot of hope, and again, a non-surgical case, and he didn't respond to the therapy, the physical therapy, the steroid injection, and he's responding to the ozone therapy. So super excited for him. And so that's just a case where folks will always wonder about, okay, what's going on over there at the Okoboji Wellness Clinic, and how do I go about applying my own health and wellness journey to what they're doing over there? And that's one example of it. Of course, many other approaches that we take when folks are spinning their wheels and maybe aren't sure where to go next. But yeah, microbiome, Dave, the gut, wow. And that, as Molly Avery's just done a fantastic job heading this up at the clinic, and we are just getting really busy focusing in on the digestion tract visits, the microbiome. And I think it's going to be foundational. Yeah. I really do. I feel that folks are going to, we've already impacted some folks that have come from a distance from, and I think I shared her story from a little gal out of South Dakota that we've been working on her gut digestion and microbiome, and she was missing so much school last year, this poor little gal, that mom was desperate. She was hospitalized, and she was given the diagnosis of a functional abdominal pain. And so they really did scopes, really couldn't find anything going on with her. Well, we had to take a deeper look at a molecular level. And what's happening in her microbiome and her gut started down that pathway. And she is on her way to positive steps and hopefully back to school and normal 10-year-old next year.
That's cool. Now, listen, we're out of time, but one thing I want to touch on real quick here is the amazing amount of tools that are available, both traditional and non-traditional, at Okoboji Wellness Clinic. Mitochondria, a term I never even really heard of, and the fact that this can be tested for to see what kind of shape your mitochondria.
Yeah, we can test it, Dave. Check that P&OE. We'll check your mitochondrial health.
Yes, exactly. And then when you see mental health care providers, for years and years and years, all we heard about was the word serotonin. And now mental health care providers are talking about, that mental health thing, anxiety, depression, that might actually birth itself in the gut.
Speaking of one other thing, it's huge. It's just like, whoa. My friend, Dr. Stephen Meek, great guy. He's over in Sioux Falls. He's an integrative psychiatrist. So he's an MD over there. And he is hot on this topic. So I have folks that maybe need to bridge and be on some of these pharmaceuticals for a bit. But he's at the same time looking at the microbiome. And this is somebody that, again, that's a psychiatrist that's traditionally trained. How cool is it that he is looking at serotonin and knows about the gut and the connection? So it's happening.
It is really happening. I want people to make sure they realize, don't lose hope. There is hope, and there's lots of tools available at Okoboji Wellness Clinic. How can they visit with you or come see you?
Give us a call, 712-339-6024. We are at 3305 Berquist Avenue, Highway 71 in Spirit Lake, right next to Ace Hardware, across from Quick Star. And we got an incredible team here. I'm blessed to have a team that continues to grow. They're very smart. They ask the right questions, and they are here to serve and help you on that health and wellness journey.
All right. Very good. Dr. Meyer, thank you so much. Happy birthday to the USA this week. Have a great 4th, and we'll chat again next week.
All right.
All right.
Happy 4th, everyone.
Dr. Bradley Meyer, the Okoboji Wellness Clinic. You can find out more, okobojiwellnessclinic.com.